So I recently had a genetic profile test done under the recommendation of my psychiatrist, and got the results today. Um, our genes play a huge role in how we metabolize certain drugs, how they affect us or don't affect us. And because I've been through so many medications and had a lot of problems with them, he wanted to get an idea of, okay, maybe we can learn something from this about what might work, obviously what might not work, and give us a better idea of where to go from here instead of blind trial and error. So I wanted to just kind of put some of those thoughts down. A really good analogy for understanding how your genes play a role in all this is something similar to people can be anemic, have an iron deficiency, that no matter how much iron they eat or consume, their body has a really hard time absorbing it. It just flushes it out, just doesn't absorb it. So you can have iron levels in your blood, but not really being used appropriately, and other kinds of things like that. So that's kind of a similar analogy. One of the things we found out going through this is I have a high likelihood of a negative interaction, negative effects, side effects, or just not having any success, being intolerant to SSRIs. Which isn't a surprise because they typically haven't worked for me, even though I've tried like a dozen. Not really, that's not really an exaggeration. And typically they have a lot of side effects with them. So I guess this makes sense. Partly also really frustrating to know that I went through a lot of that trial and error. Regardless, moving on. That I would show that I would probably have a good response to stimulants, and which has been kind of the case for the depression, incredible fatigue, and also my ADHD brain. Some of those medications really help not only lift my mood, but have a clear mind and all that kind of stuff. So that's been really beneficial. Another one, which we had kind of guessed with my family history, is genetic abnormality with L-methylfolate, which is, you can call it the MTHFR gene. And that is responsible for breaking down folic acid, which, if you have a problem with this gene, you might be taking in plenty of folic acid in your diet. It's certainly added to a lot of foods, breads, grains, cereals, multivitamins. But if your body does a terrible job of breaking it down, then you don't get the benefit of it. Unfortunately, this is really important for, it's a factor in your body's ability to produce serotonin and other neurochemicals. They've just seen there's a link, there's some correlation of depression and a deficiency in this area. So we kind of guessed that was the case, but now we know. And there's some ideas and medications that I can take for it. Another thing that shows is I'm likely to respond to glutamate receptors instead of the serotonin stuff, which is the typical antidepressant medication. Maybe something like this would help. And then lastly, the big takeaway was that I'm an ultra rapid metabolizer, apparently, which means that I kick a lot of these medications out of my system really fast, and it doesn't, they don't have a benefit. And then I have to take a lot of the medication, which I've unfortunately had to do with some of these. And then I have a lot of side effects because I have to take huge amounts. So I'm not getting any benefit from the meds, but I'm also getting all the side effects. So that's kind of a rundown of today. And where we go from here is trying maybe some new medications or getting off of stuff. And we just go from there. And I guess that's the best we can do for now. So that's my update for today.